Welcome back to Cycle Wisdom, where we empower women to restore natural menstrual cycles, to improve health, and promote fertility. I'm your host, Dr. Monica Minger, and I'm so glad you're listening today. What if your hemoglobin A1C lab result says you're fine, but your cycles disagree or you feel like there is something else going on? Today, we're going to unpack why early insulin problems can derail ovulation long before your blood sugar looks abnormal, which tests actually reveal the problem, and the cycle time steps that help you to restore predictable, healthy ovulation. So let's get started, as always, with a patient story about Kara. Now, Kara came to see us when she was in her mid-30s. She worked as an interior designer and noted that she had irregular cycles that ranged anywhere from 35 up to 55 days apart. She and her husband had been trying to conceive for 7 months by the time she came to see us. She was frustrated and confused because her primary care doctor had ordered labs and she was told that everything was normal, including her thyroid hormones, prolactin, and progesterone. Although we later discerned that her progesterone was actually quite low. She also had some blood work done checking her fasting glucose or blood sugar, which was 92, and her A1C or hemoglobin A1C was 5.3%. Now, both of these are considered normal, so she was told nothing wrong here, just relax, go home and try to get pregnant, and let us know if a year has passed. She had tracked her cycles and knew that something was wrong based on the irregularity of her cycles and seeing prolonged mucus patches without clear identification of ovulation. So she scheduled an evaluation with our clinic because she wanted more answers, and she had an innate sense that something else was going on, because why else would she have such irregular cycles? So when we looked at Kara's charting, we saw long follicular phases. So it took her a long time from the time that her period started until she finally ovulated. She occasionally even had some mid-cycle spotting and bleeding and variability of her luteal phase. So sometimes after ovulation until the next period started, sometimes she was at 7 days, sometimes she was at 12, but pretty consistently was averaging somewhere around 9 days in her luteal phase. We also looked at other symptoms that Kara was having. She told us that she had been gaining weight, especially around her midsection, despite regular exercise. She also oftentimes felt like she had an afternoon crash and had significant sweet tooth or carbohydrate cravings. So we started with our basic lab work, which included the full panel of hormone evaluation. Some of the things that we found and were specific to Kara's story is that we did a full oral glucose tolerance test with insulin testing. Now, if you're not familiar with what this is, basically what happens is you come into the lab fasting, so nothing to eat or drink for 10 or 12 hours prior other than water. We draw your blood first thing in the morning. Then we have you drink a sugary drink in order to mimic increasing your blood sugar with a meal or with sweetness. And then we recheck your blood sugar and insulin every 30 minutes for 2 hours. So by the end of this test, we have 5 blood tests that check glucose and insulin. And what we found for Kara was that her fasting insulin was just mildly elevated at 12. Our cutoff would be 10. However, after she had the sugary drink, her other insulin levels over the course of the next 2 hours were very elevated, despite the fact that she was able to maintain a normal blood sugar reading for all 5 of those readings. We also found that her sex hormone binding globulin was low and her free testosterone was a bit higher. Her progesterone, after we rechecked it again, 7 days after ovulation, was actually quite low. Now, her primary care doctor had told her it was normal because it looked like she ovulated, but just because we check the box and say that yes, you've ovulated does not mean that it is an optimal ovulation. And progesterone is a very strong predictor of optimal ovulation because it is a reflection of the size and quality of the corpus luteum, which is basically the shell or the follicle around the egg after the egg releases during that ovulation period. So what we did next was really important because rather than just saying, here's a bunch of hormones, hopefully this ovulation stimulation medication can work, is that instead we focused on the key problem, which for Kara was insulin resistance. And so focusing first on a protein-forward breakfast, taking walks after meals when she was able to do so, and focusing not just on any old random exercise, but specifically on resistance training, because resistance training and increasing your muscle mass will increase your body's ability to store glucose without requiring so much of the insulin. We also started her on some myo-inositol and made sure that she was getting adequate amounts of protein, carbohydrates, and fiber in her diet on a regular basis. Over the course of the next 3 cycles, Kara's cycles dramatically improved, and she was down to a range of 30 to 35 days apart. Most importantly, by the 4th month of working with us, she had a clearly identified fertile window and a clear day of ovulation, which makes being able to get pregnant so much easier when you can target that range and know that your hormones are not only normal, but optimal in order to succeed with pregnancy. So let's take a little step back and kind of look at the big picture here. Why does insulin resistance matter and why does it disrupt cycles? So early elevations of insulin, even if you still have normal blood sugar or a normal hemoglobin A1C, can lower your sex hormone binding globulin, and this in turn increases your free testosterone. For more detailed explanation of this, go back and listen to podcast episode number 124, where I talk all about how SHBG can influence and impact not only your symptoms, but ovulation and fertility. So when we have these elevated free androgens like testosterone, it actually impairs the development of your follicle. This can then make an erratic or delayed ovulation and a shorter or non-existent luteal phase. When women are getting their hemoglobin A1C checked, this is oftentimes a very late marker of insulin resistance or blood sugar problems. So if you're not familiar with what hemoglobin A1C is, it's actually an average of your blood sugar readings over the course of the last 3 months. Now, we typically use it to diagnose diabetes and to track overall trends and changes, but A1C is a very poor marker of insulin resistance and even of blood sugars because it misses spikes and exaggerated insulin responses, which are the earliest signals of trouble. For example, you can eat and have normal blood sugar, but your insulin levels can be very high throughout the day, which can still impair ovulation despite having a normal glucose. Or maybe you have erratic spikes of your blood sugar after a meal that are getting up to 200 or 250, but if the majority of your day, your blood sugar is normal or maybe even low, your hemoglobin A1C can still look completely normal despite having those high peaks of blood sugar. So this is why A1C is a very poor marker of insulin resistance. And in fact, in our practice, we don't even check it as a lab test because it does such a poor job of picking up early insulin resistance. So how do I know if insulin resistance may be playing a role, or what are the things that I might notice with my cycle? So as with Kara, one of the most common things we see is inconsistent ovulation. Now, this may mean that it comes much later than expected or is delayed, or it might mean that it doesn't show up at all. For some of our clients, we see that they have multiple LH urinary strips that are positive without a clear shift. So if you have an LH strip that is positive for 5 or 6 days in a row, that's abnormal. We normally would expect to see that LH be positive 1 or maybe 2 days, in rare cases 3, but typically that LH surge should happen fairly quickly. It should come on and then it should decrease back to normal again. When we see that LH being elevated for a prolonged period of time, that can indicate that ovulation is not actually going to occur. We oftentimes can also see a short luteal phase. So again, very often this will run hand in hand with low progesterone because we have a poor quality ovulation. So that might mean that the follicle itself is too small. When we have that too small follicle that then finally releases the egg, that follicle is what becomes the corpus luteum, which is what triggers your body to produce more progesterone. If that follicle is small, the corpus luteum is small, and then the progesterone is going to be lower, which then leads to that shortened luteal phase. So if you're trying to conceive, a shortened luteal phase is bad news because fertilization can still occur, but if your body doesn't have enough time to allow implantation to occur before your next cycle starts, it will make it very challenging in order to stay pregnant. The other sign that you may notice from a standpoint of your cycle or other symptoms would be those that are related to having a low sex hormone binding globulin, which means increased expression of testosterone. Now, this can manifest as increased acne or facial hair growth or hair growth on your chest, around your breasts, around your belly button. You can also notice central weight gain. So typically this is going to be weight gain specifically around your belly and your hips. Many women also will notice feeling like they have an afternoon crash. So after that lunchtime happens, that they just feel really, really tired after a couple of hours, or sometimes just erratic feelings regarding your blood sugar. I feel like it's too high. I feel like it's too low. I have sudden pangs of feeling like I'm really, really hungry. And what we see with this is that your blood sugar itself may be stable, but if the insulin is spiking or crashing erratically, this can cause some significant issues. Now, the good news is that insulin resistance is highly modifiable, and we can make significant changes with this well before your body would progress onto blood sugar changes of diabetes. So what we focus on first is always going to be charting. And you hear me say that week after week after week, is that we want to observe when is ovulation happening? Do we see a clear and consistent pattern that shows that ovulation is happening? We also oftentimes will recommend that you map other symptoms along with your cycle days. So times when you have increased stress or sleep disturbances or problems with gut dysfunction, all of those can give us good insight as to what else might be going on that may be delaying your ovulation. Again, we focus next on that metabolic testing and checking the right things. So specifically for our patients who we have concerns with irregular cycles or erratic ovulation, we're going to check an oral glucose tolerance test. We check your insulin along with that. And again, that test is over the course of 2 hours. Now, in some cases, it's not feasible or not possible to do that oral glucose tolerance test, or in some cases, our clients don't tolerate it because it can be a problematic test having to drink all of that sugary liquid. In those instances, we calculate what's called a HOMA-IR score, and basically, it's an easier way to look at just somebody's fasting blood sugar and their insulin, and then put it into this calculation that helps to determine how concerned need we be regarding insulin sensitivity. So a normal HOMA-IR score is anything less than 2, and in our world, anything is optimal if it is actually less than 1. If your HOMA-IR score is anything above 2, then we say, yes, there's some insulin resistance present, and if it's above 3, typically that is going to be significant insulin resistance. Now, it's interesting because if you look across the world, different labs will say different levels as far as where insulin resistance resides. Now, we don't make a diagnosis of insulin resistance just based on one factor, but calculating this HOMA-IR can give you a good idea as to where you fall on that scale. We also oftentimes will consider checking your cholesterol panel. So specifically, HDL and triglycerides can be affiliated and impacted when it comes to other metabolic dysfunction. We also are going to always take a look at your full hormone panel, making sure not only that numbers are within normal range, but that they are optimized. And in certain situations, if we have concerns for the possibility of polycystic ovarian syndrome, we may also check a pelvic ultrasound if clinically indicated to look for anatomic changes of your ovaries. Things like enlarged ovaries or multiple small follicles on the ovaries can be indicative of polycystic ovarian disease. Now, this is not specifically diagnostic and does not always run hand in hand with insulin resistance, but it is a very common phenomenon to have insulin resistance along with PCOS. So we always want to make sure we understand and uncover all of the pieces that may be playing a role with your insulin resistance. So what do I do if I've been told I have insulin resistance? What are some things that I can do to change my trajectory today? So if you're looking for a complete explanation that maps out your entire day of meal planning, I would refer you back to episode number 107, where I talk all about insulin, glucose, and how it has an impact on your hormones. If you're looking for what are the quick and easy overall things that I need to pay attention to, what we really tell people to focus on is that breakfast will set the tone for the rest of your day. So ideally, having 30 grams of protein within the first 60 minutes of being awake is ideal. So think about things like eggs, Greek yogurt, cottage cheese, a protein smoothie. And what I would suggest is really pay attention to how much protein is in each of those things. For example, many of my clients come in and say eggs are a great source of protein for me. But did you know that one egg has only 6 grams of protein? Now that's great, but if we're looking for 30 grams of protein with breakfast, I don't know many people that are eating 5 whole eggs with breakfast. So you may need to get creative about combining your eggs with another source of protein, or you could say, I'm going to have 5 egg whites and then have other things along with it, because the egg white is actually where the majority of the protein resides in an egg. We also want to focus on, with breakfast, adding in fiber and healthy fat, keeping your refined sugars or your carbohydrates minimal. Now, I don't want it to be zero. We need some glucose or carbs or sugar in our world in order to let your brain function. So if you're looking for easy round numbers, we say 30 grams of protein, 30 grams of carbs or less. So focus on that for your breakfast. The other thing that I would focus on is trying to get a 10-minute walk in after your meals. Specifically with your midday and your evening meal can make a big difference as to how your body absorbs your blood sugar. So for example, if you go for that 10-minute walk, it's going to burn through more of the sugar. We also find when it comes to exercise that if you are building muscle, you are increasing insulin sensitivity. When you have higher muscle mass, your body is able to absorb more of that sugar, and your body doesn't need to secrete as much insulin in order to keep that blood sugar balanced. Now, this does not need to be anything as far as extreme weight training, but what we're talking about is full body strength training, 20 to 30 minutes, even 2 or 3 days per week. This can be something as simple as doing squats or wall push-ups or resistance bands. It does not necessarily mean you have to break out the heavy weights and go to the gym. On the other days that you're not doing the resistance training, that's where we talk about having a brisk walk or low impact cardio on the other days. If you are extremely overtraining or over-exercising, that can actually impair or suppress ovulation. So again, everything in moderation. And then in some cases, it makes sense to institute other supplements that help with balancing insulin resistance and blood sugar, things like myo-inositol. And we've talked about this in the past, but myo-inositol at a dosage of 2 grams per day, usually we split that over the course of 2 separate meals, can help to improve ovulation function and insulin sensitivity, particularly with polycystic ovarian syndrome. We always want to pair this with lifestyle changes for best results because, again, if we don't need to be on a supplement long-term, that's always the best. And then in some situations, metformin may be needed. We always want to focus on improving lifestyle and trying myo-inositol first, but if glucose or insulin are very high, or if we need something else to help shift and move us in the right direction, metformin can absolutely be a wonderful option in cases where insulin resistance is playing a large role. So a couple of questions that we commonly get asked. First and foremost, my A1C is fine. Does that mean everything is okay? Again, as in Kara's case, possibly, but that A1C oftentimes will miss those early insulin spikes. So if your cycles are irregular, or if you have symptoms of blood sugar problems or insulin spikes, always so important to get that full evaluation with an oral glucose tolerance test, checking the insulin along the way. Because again, insulin will change well before your blood sugar starts to spike, which is what's reflected with that A1C. How fast will I notice changes? So oftentimes we'll see that ovulation timing and the cervical mucus patterns can shift even within 1 to 2 cycles. The other pieces like your luteal phase length, things like sex hormone binding globulin and androgens oftentimes take a bit longer. Usually we say 2 to 3 months, but again, this is not a multiple year process. We can make these changes and see these shifts happen significantly within the course of a couple of cycles. And then probably most importantly, do I have to exercise in order to make this happen? Do I have to lose weight? Not necessarily. Many times we find that women will gain muscle when they are focusing on strength training, when they focus on timing their meals appropriately and balancing their protein and carbs. We do find that many women lose weight along this process, but it does not need to mean that we stick to strict dietary changes or things that are not going to be sustainable. The last thing we want to do is to create a new dietary habit that is not able to be sustained for the long term. Imagine if your fertile window stopped playing hide and seek because you addressed insulin resistance early, before your blood sugar or your hemoglobin A1C ever looked bad. Over the next few months, your ovulation can land predictably. Your luteal phase can be more strong, and meals can give you steady energy throughout the day instead of that crash to help improve health and promote fertility. If you're ready to work with our elite team of healthcare professionals, go to our website, radiantclinic.com, to schedule a free discovery call and learn more about our package-based pricing for comprehensive care. We are currently able to see people for in-person appointments in our Cedar Rapids, Iowa clinic, or can arrange for a telehealth visit if you live in many different states across the U.S. Check out our website for current states that we can serve medical clients, and let us know if your state is not listed to see if we can still cover you there, as we are constantly expanding our reach. Please note that our fertility educators are able to take care of clients no matter where they live. Thank you so much for listening to this episode. Please share this podcast with someone in your life who would benefit from our services. Remember to subscribe to this podcast for more empowering content that I look forward to sharing with you on our next episode of Cycle Wisdom.